Hello students, today I am going to discuss about the important clinical scenario based questions regarding the muscles of upper limb only. So let's discuss some questions one by one. Now this is the first question. A 25-year-old man sustains a deep laceration on the anterior aspect of his forearm. That means you will have the question related to the muscles of forearm. On examination, he is unable to flex the proximal interphalangeal joint. So, which joint is not working? Proximal interphalangeal joint is not working of his middle finger. But flexion at distal IP joint is intact. So distal IP joint is normal and this proximal IP is not working. Which of the following is most likely injured? Now, dear students, whenever we are talking about the interphalangeal joint movements, there are two main muscles which are working, flexor digitorum profundus and superficialis. Now, when you will see the insertion of all these two muscles, you have to keep this thing in mind that the flexor digitorum superficialis muscle tendon will split and then it will go and insert on the side of your middle phalanx, but the tendon of flexor digitorum profundus will reach up to this distal phalanx. Now you will see that proximal interphalangeal joint, that means this joint is not able to flex, but still this joint is patient is able to flex. That means the flexor digitorum profundus is normal because it is working on the distal IP joint, but the flexor digitorum superficialis is having some problem, and that's why the proximal IP joint is unable to flex. So the answer is B. There is a injury in the tendon of flexor digitorum superficialis. Now we'll move to the second question. A 45-year-old man present with inability to flex the tip of his ring and little finger. So this is the question about the little and your ring finger. This means these two fingers. This is the little finger, this is the ring finger. Which of the following statement about the flexor digitorum profundus is incorrect? So it is purely the question about the flexor digitorum profundus. It originates from the anterior ulnar and interosseous membrane. I think it is right. It inserts into the palmar surface of the distal phalanx of digits 2 to 5. I just told you that they approach up to the tip of the fingers, that means up to the distal phalanx of all the four fingers. It flexes the finger at DIP joint. Yes, we have just finished this question. It is supplied by the median nerve to digit 4 and 5. Now here you have to concentrate on this fourth option, that though the flexor digitorum profundus is supplied by median nerve, but that part supplies lateral half, not the medial half. And it is about the digit 4 and 5, which is the medial half. That means you are talking about the muscle acting on the little and ring finger. So this component of the muscle is supplied by ulnar nerve, not by the median nerve. So this fourth is the answer, that the part of the muscle supplied by median nerve is wrong. Now we'll move to the next question. Which of the following muscle is supplied by the two nerves with different root values? Now this is again the question where you can see the all four option, where you will realize that this is the only flexor digitorum profundus is the only muscle which is supplied by the two nerves. So the answer is very clear here. The answer is your D option, because this is a hybrid muscle which is supplied by the ulnar nerve as well as by the median nerve. Clear? So here you have to keep this thing in mind, that whenever you are having the question about the two nerve supply in upper limb, the most important answer is flexor digitorum profundus contributed by ulnar and median nerve. Now we'll move to the next question. Which of the following muscle of forearm not supplied by median nerve? So when you will have the muscles of forearm, it is having superficial and deep group. Now out of all the muscles, one and half muscles are not supplied by median nerve. So which one and half muscle? Flexor carpi ulnaris and medial half of flexor digitorum profundus. So these one and half muscles are supplied by ulnar nerve. So you have to find out the answer. Flexor carpi radialis no, flexor digitorum superficialis no, This is flexor carpi ulnaris, which is supplied by ulnar nerve. Now we'll move to the next question. A patient is asked to extend his thumb. Clear? Now a triangular depression become visible on the lateral aspect of the wrist. The medial border of this depression is formed by which of the following tendons? So whenever you are having this question, it is basically about the anatomical snuff box. Because when you will do the extension of thumb at the base, you are able to see a triangular structure, and that is anatomical snuff box. So this question is about the medial boundary of anatomical snuff box. So you know that there are three tendons, two in the lateral boundary, one in the medial boundary, and the tendon present in the medial boundary is extensor pollicis longus. So the answer is C, extensor pollicis longus. Clear? Now we'll move to the next question. A 35-year-old man has difficulty in holding a piece of paper between the thumb and index finger. So when you will see that patient is not able to hold the paper between the thumb and index finger. Okay? So on the examination, when asked to hold the paper, he flexes the interphalangeal joint of the thumb. So there are two ways. Either you can hold it like this, and in the second way you just flex. So rather than making this straight, the person is flexing his thumb to hold the paper. So which of the following primarily muscle is weakened? So this is known as Froment sign, and Froment sign is done to see the integrity of your muscle is known as Adductor pollicis. So this is classically the Froment sign where patient is not able to hold the paper between the thumb and your index finger, and he will do the flexion at interphalangeal joint of thumb. So this is what is about adductor pollicis. Now the next question is that during a fracture involving the dorsal tubercle of Lister of the radius, which tendon is most likely affected? So when you will do the side determination of the radius, I have told you that you have to find out the posterior side of the radius where you will have a projection is known as your dorsal tubercle of Lister. Now just next to the dorsal tubercle on the medial side you will have a very prominent groove, and that groove is the tendon is known as extensor pollicis longus, which will change the direction and it approaches towards the thumb. So whenever there is an injury occurs into the dorsal tubercle of Lister, actually this tubercle is providing the pulley-like action for this muscle. So this muscle is going to affect because of the injury to this dorsal tubercle of Lister. Now we'll move to the next question. A muscle acting as a lateral rotator of the arm is supplied by a nerve that bears the pseudoganglia along its course. Now which of the following muscle is this? Now what is ganglia? Ganglia is a collection of neuronal head outside the CNS, like sympathetic ganglia, like any ganglia of cranial nerve. But here you are using word pseudo. That means when you will see with the gross eyes, you will realize that there is a dilatation present in the nerve. But when you will put that dilated part under microscope after doing the sectioning, you will realize that it is not the collection of neuronal head. It may be due to the collection of fat in the neural sheath. So it is not a true dilatation. And which nerve of upper limb is having the nerve supply by the pseudoganglia? So dear students, you have to keep this thing in mind that teres minor is supplying the teres supplied by the axillary nerve. Now when the axillary nerve supplies the teres minor, it is supplied by that pseudo dilatation of axillary nerve is known as pseudoganglia. So the answer is teres minor muscle. Now we'll move to the last question of this session. During a minor laceration repair on the medial side of palm, the surgeon notes a thin subcutaneous muscle. Now see, this is again a very unique muscle which is present in the upper limb. Generally, subcutaneous muscles are the feature of the face, so that you are able to produce the different facial expressions. Now this muscle which is present subcutaneously improve the grip by producing the wrinkles on the skin over the hypothenar region. So when you will see your palm, you have to keep this thing in mind. When you will have this hypothenar area, in this hypothenar area, the skin is having a subcutaneous muscle which produces the wrinkles to improve the grip. So that muscle is known as Palmaris brevis. So which is not true about this muscle. So you have to find out the wrong statement about this muscle. So it is a remnant of panniculus carnosus. Yes, all the subcutaneous muscles are the remnant of this. It is formed by the smooth muscle supplied by branch of ulnar nerve. It is also true, but this B is wrong. So what is the answer? The answer is B, because this is the answer, because it is not a smooth muscle, it is basically a skeletal muscle. So the statement B is not true about this subcutaneous muscle of your palm. Clear? So this is the end of today's session. In this session, I try to with most important clinical scenarios based questions of the upper limb. I hope these questions will definitely help you in your exams. Thank you and bye bye.